This is why you need Knowledge Your Health. The shocking truth about smoking. Smoking is a global epidemic, claiming millions of lives each year. It's a harsh reality, but one we must confront. Cigarettes, those seemingly innocuous rolls of tobacco, are silent killers, laden with thousands of harmful chemicals. These chemicals wreak havoc on the human body, leading to a plethora of health problems. The statistics paint a grim picture, revealing the true extent of smoking's devastating impact. Each year, smoking-related illnesses claim the lives of over 8 million people worldwide. This shocking figure represents a preventable tragedy of immense proportions. Moreover, smoking doesn't just affect smokers themselves. Passive smoking, the inhalation of secondhand smoke, poses significant health risks to non-smokers, including children. It's a stark reminder that smoking is not a personal choice confined to the smoker. Its consequences ripple outward, affecting families, communities, and global health. The financial burden of smoking, both in terms of healthcare costs and lost productivity, is staggering. Governments and individuals alike bear the weight of this preventable epidemic. We must acknowledge the severity of this issue and take action. Education, awareness campaigns, and support systems are crucial to combating smoking. By understanding the risks and consequences, we can empower individuals to make informed decisions about their health. Breaking free from the grip of smoking is possible, and the benefits are immeasurable. Tar, the sticky enemy within. Tar, a thick, sticky substance, is a major culprit in the dangers of smoking. When tobacco burns, it releases tar, which is inhaled and deposited in the smoker's lungs. Imagine this: every puff of a cigarette delivers a dose of tar, coating the delicate tissues of your respiratory system. Over time, this tar buildup has devastating effects. The lungs, designed for the effortless exchange of oxygen and carbon dioxide, become coated with this sticky residue. This coating inhibits their ability to function properly, leading to a host of respiratory problems. Bronchitis, a condition characterized by inflammation of the bronchial tubes, is a common consequence of tar accumulation. Smokers often experience persistent coughs, wheezing, and shortness of breath as their airways struggle to clear the tar. Emphysema, another debilitating respiratory disease, is also linked to smoking-related tar buildup. This condition destroys the air sacs in the lungs, making breathing increasingly difficult. The once elastic tissues of the lungs lose their ability to expand and contract, leaving smokers gasping for air. The damage caused by tar is often irreversible, highlighting the importance of quitting smoking before it's too late. Furthermore, tar doesn't just affect the respiratory system. It enters the bloodstream, where it contributes to the hardening and narrowing of arteries, increasing the risk of heart attacks and strokes. The toxic chemicals present in tar also damage DNA, increasing the likelihood of developing various cancers. The insidious nature of tar makes it a particularly dangerous component of cigarette smoke. A nicotine's grip. Addiction and its consequences. Nicotine, a highly addictive substance found in tobacco, lies at the heart of smoking's powerful hold. When inhaled, nicotine enters the bloodstream and travels rapidly to the brain. There, it triggers the release of dopamine, a neurotransmitter associated with pleasure and reward. This surge of dopamine creates a pleasurable sensation, reinforcing the act of smoking and making it difficult to quit. Over time, the brain becomes accustomed to this nicotine-induced dopamine rush, leading to dependence. Smokers begin to rely on nicotine to feel normal, experiencing withdrawal symptoms when they try to quit. These symptoms, which can include irritability, anxiety, difficulty concentrating, and increased appetite, make it challenging to break free from the cycle of addiction. The addictive nature of nicotine is a major obstacle to quitting smoking. Many smokers find themselves trapped in a vicious cycle, smoking to relieve withdrawal symptoms and further reinforcing their dependence. Understanding the science behind nicotine addiction is crucial for breaking free from its grip. Fortunately, there are effective strategies and resources available to help individuals overcome nicotine addiction. Nicotine replacement therapies, such as patches, gum, and lozenges, can provide a controlled dose of nicotine to alleviate withdrawal symptoms. Medications such as bupropion and varenicline can also help reduce cravings and withdrawal effects. Behavioral therapies such as counseling and support groups provide smokers with coping mechanisms and strategies to manage triggers and cravings. Visit knowledgeyourhealth.com for more information. Cancer, a deadly connection. The link between smoking and cancer is undeniable, supported by decades of scientific research. Cigarette smoke contains a cocktail of carcinogens, substances known to cause cancer. These carcinogens damage DNA, the genetic material within cells, disrupting normal cell growth and leading to the formation of cancerous tumors. Lung cancer, one of the deadliest forms of cancer, is strongly associated with smoking. The tar and other harmful chemicals in cigarette smoke directly damage the delicate tissues of the lungs, increasing the risk of this aggressive disease. Smokers are far more likely to develop lung cancer than non-smokers, and smoking is responsible for the vast majority of lung cancer deaths. But the dangers don't stop there. Smoking also increases the risk of numerous other cancers, including cancers of the mouth, throat, esophagus, stomach, pancreas, bladder, kidney, cervix, and leukemia. The carcinogens in cigarette smoke travel throughout the body, wreaking havoc on various organs and increasing the likelihood of developing these life-threatening diseases. The evidence is clear. Smoking significantly elevates the risk of cancer. Quitting smoking is the single most important step individuals can take to reduce their cancer risk. While the damage caused by smoking is not always reversible, quitting allows the body to begin healing and reduces the risk of further damage. For more information, visit knowledgeyourhealth.com. Respiratory distress, smoking's toll on your lungs. The respiratory system, responsible for the vital exchange of oxygen and carbon dioxide, bears the brunt of smoking's harmful effects. Cigarette smoke irritates and inflames the delicate tissues of the lungs, leading to a range of respiratory problems. Chronic obstructive pulmonary disease, or COPD, a group of progressive lung diseases, is a major consequence of long-term smoking. COPD encompasses conditions such as chronic bronchitis and emphysema, both of which make breathing difficult. Chronic bronchitis causes inflammation and mucus buildup in the bronchial tubes, leading to persistent coughs, wheezing, and shortness of breath. Emphysema destroys the air sacs in the lungs, reducing their elasticity and making it harder to exhale air. As COPD progresses, everyday activities such as walking and climbing stairs become increasingly challenging. Smoking also increases the risk of respiratory infections. Cigarette smoke damages the cilia, tiny hair-like structures that line the airways and help remove mucus and foreign particles. This damage weakens the lungs' natural defenses, making smokers more susceptible to colds, flu, and other respiratory infections. Respiratory infections in smokers tend to be more severe and longer-lasting, further compromising lung function. The impact of smoking on the respiratory system is profound and often irreversible. Quitting smoking is essential for protecting lung health and preventing further damage. While some damage may be permanent, quitting allows the lungs to begin healing and reduces the risk of developing more serious respiratory problems. Heart under siege. Smoking's impact on cardiovascular health. Smoking's detrimental effects extend beyond the respiratory system, significantly impacting cardiovascular health. Cigarette smoke contains a multitude of substances that damage the heart and blood vessels, increasing the risk of heart disease, heart attacks, and strokes. Nicotine, a key component of cigarette smoke, acts as a stimulant, constricting blood vessels and raising blood pressure. This constriction forces the heart to work harder to pump blood throughout the body, putting additional strain on the cardiovascular system. Over time, this increased workload can weaken the heart muscle and damage blood vessels, increasing the likelihood of heart problems. Furthermore, smoking lowers good cholesterol levels and raises bad cholesterol levels, contributing to the buildup of plaque in the arteries. This plaque buildup, known as atherosclerosis, narrows the arteries, restricting blood flow to the heart and other vital organs. If a blood clot forms and blocks a narrowed artery supplying the heart, it can lead to a heart attack. Similarly, if a blood clot blocks an artery supplying the brain, it can cause a stroke. Smoking is a major risk factor for cardiovascular disease, and quitting smoking is crucial for protecting heart health. By quitting smoking, individuals can significantly reduce their risk of heart attacks, strokes, and other cardiovascular problems. The cardiovascular system begins to heal soon after quitting, with blood pressure and heart rate returning to normal levels. Breaking free, understanding addiction's hold. Quitting smoking is a challenging but achievable goal. Understanding the nature of addiction is crucial for breaking free from its grip. Nicotine addiction, like any addiction, is a complex interplay of physical, psychological, and social factors. Recognizing the powerful hold of nicotine is the first step towards overcoming it. Physically, nicotine dependence creates withdrawal symptoms when smoking is stopped. These symptoms, which can include irritability, anxiety, difficulty concentrating, and increased appetite, can be intense and make it difficult to quit. However, it's important to remember that these physical withdrawal symptoms are temporary and will subside over time. Psychologically, smoking often becomes intertwined with daily routines, emotions, and social situations. Smokers may associate smoking with specific activities, such as drinking coffee or socializing with friends. Stress, boredom, and other emotions can also trigger cravings. Identifying these triggers and developing coping mechanisms is essential for successful quitting. Socially, smoking is often influenced by peers, family members, and cultural norms. Support from loved ones and healthcare professionals can make a significant difference in quitting success. Joining a support group or seeking professional counseling can provide smokers with the tools and encouragement they need to overcome addiction. Visit knowledgeyourhealth.com for more information. The journey to freedom, quitting and reclaiming your health. Quitting smoking is a journey, not a destination. There will be challenges along the way, but the rewards are immeasurable. The benefits of quitting begin almost immediately and continue to grow over time. Within minutes of quitting, heart rate and blood pressure begin to return to normal levels. Within hours, carbon monoxide levels in the blood decrease and oxygen levels improve. Within days, the sense of taste and smell begin to return and lung function starts to improve. Within weeks, circulation improves and lung capacity increases, making breathing easier. Within months, coughing and shortness of breath decrease and energy levels increase. Within years, the risk of heart disease, stroke, lung cancer, and other smoking-related diseases significantly decreases. Quitting smoking is the single most important step individuals can take to improve their health and well-being. There are many resources available to help individuals quit smoking, including nicotine replacement therapies, medications, behavioral therapies, and support groups. Choosing the right approach depends on individual needs and preferences. It's important to consult with a healthcare professional to develop a personalized quitting plan. Remember, quitting smoking is a journey, and setbacks are a normal part of the process. Don't be afraid to seek support and try again. For more information and support, visit knowledgeyourhealth.com. A breath of fresh air. Embrace a smoke-free future. Imagine a life free from the grip of smoking, where every breath is a breath of fresh air. Quitting smoking is not just about eliminating a bad habit, it's about reclaiming your health, vitality, and freedom. Embrace the opportunity to transform your life and experience the countless benefits of a smoke-free future. Picture yourself waking up each morning with clear lungs, free from the hacking cough that once plagued your mornings. Imagine engaging in physical activities with ease, your body no longer limited by shortness of breath. Envision enjoying the simple pleasures of life, like tasting your favorite foods and smelling the flowers in bloom, with senses heightened by your smoke-free lifestyle. Beyond the physical benefits, quitting smoking brings a newfound sense of freedom. No longer tethered to the constant cravings and rituals of smoking, you reclaim control over your time, your choices, and your life. The financial burden of cigarettes lifts, freeing up resources for more fulfilling pursuits. Embrace the opportunity to be a positive influence on your loved ones, especially children. By quitting smoking, you set a powerful example of health and well-being, inspiring them to make healthy choices. A smoke-free future is within your reach. Take that first step towards a healthier, happier, and more fulfilling life. Visit knowledgeyourhealth.com for more information.